Hello friends, this is Dr. Namrata Kabra from Center for Sight Chembur. Cornea is this transparent structure which allows light to pass through and it refracts it to focus on desired position in our eye. Just imagine if this cornea is not transparent and this is translucent. Say if there is scar, if there is any opacity, will it allow light to pass through? No, it won't. So what it will result into? It might result into corneal blindness. Yes, corneal blindness is one of the, or its fourth major leading cause for blindness. And what we require as a treatment might differ based on severity, extent and location of corneal opacity. When it's very severe, involving whole of the visual axis or throughout the cornea, what we require is, and if all the layers of cornea are involved, full thickness keratoplasty or transplant. We change this cornea with a donor cornea, and after transplant surgery, a corneally blind person can again enjoy the light and life with light, I would say. If a single layer is being affected, nowadays we do have facility to change a single or particular layer of the cornea. That is known as partial thickness transplant or lamellar surgeries. Amongst that, there is DALK. If it is superficial, then DALK can be done or SALK can be done. If it is deeper opacity, then DSEK, DMEK surgeries can also be done. And in future, in pipeline, Japanese researchers, what they have figured out, they have injected important cells of last layer of cornea, and with these injections and particular positioning, they are treating diseases. So lot of advancements is happening and lot of finer treatment is available, finer surgeries are available when it comes to corneal diseases. So don't give up. If you do have corneal opacity, corneal diseases, corneal blindness, feel free to contact a cornea surgeon who can address all these issues.
Follow Center for Sight and post your queries to get answers from the experts.